Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Hey, welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. Today's episode I am doing on a topic that I actually get asked a lot from many people, but also from the Christian community. And that's what's my take on cannabis use for Christians? And so I'm going to just be upfront. I have never used cannabis. I don't like the smell of it. However, I have certified people for medical use of it. And so I do believe there is a time and place for the use of it. So we're going to go through a couple things that I often hear on both sides of this issue as it relates to using cannabis, also known as marijuana, right? I prefer to refer to it as cannabis. So God did create these plants, right? And there is a medicinal benefit and properties to it that people can use for ailments. However, I don't believe that you should use it as a crutch. It should not be idolized, just like anything else that you can idolize. I think that most people use it as it's good for everything and I can be on it for the rest of my life, right? And while I have seen people as patients that they may have to use it because of their situation, right? Their constant pain. And so, like I said, there's a time and place for it. God did create the plant, but he did not mean for you to abuse it and use it every day just because. I see a lot of really young people that they don't need it, but they use it. And so whether it's legal to use in your state or not, I think you should be wise and responsible with that because if you're saying you need cannabis for anxiety, guess what? There's so many other natural things that you can do to address anxiety. And really the most important thing is to get to the root cause of why do you have anxiety? Is it because of trauma? Is it your nervous system? Is it hormones? Is it neurotransmitters? Is it, it could be even environmental exposures that you have that are causing the anxiety. So it's really important for you to know why you're having anxiety and then treat it. I don't think cannabis should be your first go-to use that, right? And so I think that majority of people that are using it are just using it because they like the way they feel. And so I think that there is consequences that to your brain, to your body, also to you spiritually. There's complications to that you might be opening the door to things that, you don't want to be opening the door to. And by that, I mean like really demonic possession. And so I think that not just cannabis, but alcohol has the same effect. Anything that alters your state of mind is not a good thing because then you are not able to be logical and make wise decisions. You tend to make foolish decisions when your state of mind is altered. All of the people that commit crimes or do foolish things are usually on some kind of a substance. And so what I have seen in my clinic is sometimes I have people who are on 10, 15, 20 medications. And so then I recommend that because of their presentation, their illnesses and conditions that are not going to go away most likely, that cannabis would be a better alternative for them because of many things. One of them is cannabis does not have the negative side effects of the medications that they tend to be on, especially if it's for pain, right? A lot of these pharmaceutical medications are going to cause issues to the liver, the kidneys, brain, other issues. And so then they just keep adding more medications to their list. So for those people, I say this one thing can help get rid of all those medications and address all your symptoms. And that's always a win-win. What kind of cannabis, like how you're taking cannabis, the strength, the strains that are available, that matters. So I know this is not, some people are not going to agree with me on this. I already expected that this episode is probably going to bring some arguments or not everyone's going to agree. I don't believe in smoking anything. I just don't. I don't think that that is a good way to deliver the medicine. It'll make you high, that's for sure. But if that's what your goal is, and then that's what you're going to do, and you can do whatever you want to do. But from a medical perspective, there are things, say, for example, if you have celiac disease or any digestive inflammatory, like serious gut issues that have already been investigated, cannabis, like doing an edible would benefit, or even like a tincture, an herbal extraction, it would be a better benefit to the person to take it orally and make it through the digestive system. There's different types of strains. So there's like indicas and sativa. They both have a different effect. Your indicas are going to be great for sleep and pain. So usually at night, because those tend to have a little bit more of the the brain altering effects of it. It tends to downregulate. Indicas tend to downregulate people. So if someone has depression, indica is not a good strain. Sativa is the other strain. That sativa is an upper. It brings you up. So it's good for daytime use, for pain and other things, but it is going to be more stimulating, more awake. And so the secret to using cannabis and not get high is that you want to start off, just like we do with medications, herbs, and everything else, you want to start off low concentrations of THC. And then find where your tolerance is at. Where does it get to the point that it's able to help you with pain or help you get to sleep? Because everyone's tolerance is different. If someone's never used cannabis, you're more sensitive to it. You might need, less, or maybe you metabolize it slower or faster. That's going to vary from person to person. So that you want to start with low. We know CBD does not have a psychoactive effect on people, so it's not going to make you high if it's just CBD. But I will warn you, there have been people that even with CBD, they do get a high. And so they might not like that feeling. Hey, look, I've never been high, so I don't like the idea of not being in control of my mind, not being fully present. So if it's for bedtime use, like I said, I have people who have been in accidents where, like, technically they shouldn't be living, and they survived that. But now their bodies are so damaged. They had a lot of surgeries. And so now they're having to take opioids or something else for pain management. And this is a much better option because it'll help with the pain. It'll help them to sleep. And so oftentimes people who have chronic pain, they can't sleep. And if they can't sleep, then there's more stress in their body and it creates more pain. And so it has this, ongoing effect of pain and sleep, and they're not able to, sleep because of the pain. And so it just contributes to more of the pain increasing. So cannabis can be a good substitute for all those other medications. It's less harmful, and a little goes a long way. It really does. I am not in agreement with all these young people using it for anxiety, depression. They're just making excuses. But I will say, I have certified minors, right, that the parents are coming in, and sometimes they're children, and these children have seizures. Let me tell you, this helps them so much. It helps them by giving them a couple of drops of a low THC and some CBD, and there's sometimes CBD in the daytime. CBD is just a cannabinoid. We have cannabinoid receptors in the brain, which we can also stimulate those receptors in the brain by meditating and breathing exercises and just relaxing, right? Prayer, I'm sure, does the same thing. It's just no one studied it. So there's other ways to do that to reduce pain. But in children who have seizures, it is much safer for them to do cannabis, medical cannabis, versus the drugs. Now, the unique thing about cannabis that's used for medical use, here in the state of Arizona at least, that's what I know, is that if you're pregnant and you are and you have seizures, your doctor, your neurologist, and the OBGYN will provide notice that you do have seizures and you're pregnant. And that is the only time that they will okay medical marijuana for treatment in a pregnant woman. Other than that, you should not be using cannabis. And the reason that it's okay in a pregnant woman who has seizures is because the anti-seizure medication is very toxic to the baby. And they feel that it's safer for them to be on cannabis. But there's not enough studies to, in a healthy female, for them to just use cannabis. There could be negative effects to the child's brain development, the nervous system. And so you don't want to do that at all. I mean, I think it's very irresponsible, though I will tell you, I have seen and heard of women who are pregnant or nursing and they're using cannabis, and I'm not okay with that. I think that's very irresponsible. It's just possibly putting your child at risk of not having the mental and neurological resiliency have they been without cannabis use. They won't be addicted to it. It's just we don't understand the impact it has on their nervous system because it is really rapidly developing during that time. So I don't encourage that at all. So like I said, there is a time and place for cannabis. I think you just need to really be responsible with it. I don't think we should completely slash that off the table as an option. I've worked with patients who are Christian, their pastors maybe at their church, or even Mormons. Mormons are very strict about what they're able to take. You know, they don't do caffeine because it's stimulating and so forth. But I have had Mormons that have come and they're like, I have to get this approved through my church first. And I'm like, absolutely, I'm willing to provide the medical necessity and how it would be used. I don't ever encourage smoking it. I just don't. It's either topical use, so there's creams, oils that you can put on the area for pain to reduce inflammation. There's capsules that are CBD or tinctures that you could do oral, edible stuff, things like that you could do oral that will reduce inflammation. So we know CBD is very anti-inflammatory, but there's a lot of other things that are anti-inflammatory too. You could do fish oil at high doses. You can do curcumin. You can change your diet. There's a lot of things that will help with inflammation. A lot of antioxidants, things like that will help inflammation. But if someone has done that and they still, because of their condition, they still have a lot of pain, inflammation, then cannabis, CBD, in the CBD form, which is not psychoactive, again, you can do this to reduce inflammation. And we've obviously known that in conditions like with cancer, there's a lot of people, I'm not going to say I might get flagged and video taken down for violating community guidelines or something like that. But just know that there are certain things that cannabis, certain strains, certain concoctions that have been used to help reduce, improve, get rid of the C word, the cancer in people. So I'm not saying that should be your sole and only approach to treating cancer, but there's been cases where people have used it and have seen successful outcomes. So if you're Christian, is cannabis okay? Absolutely. If you have a true medical need, don't be led to feel guilty for using a plant. Just be responsible with it. That's really it. It's, do you really need it? Have you tried other options? Have you tried other things to help with your situation, your condition? And if you have and it's not working, you want to start low with, maybe just start with CBD, maybe a little bit of teaching CBD for, there's the dispensaries. They're the ones who are really more versed on what to take in the morning and daytime. I mean, I'm trained. We actually had part of our botanical training. So we learned over 250 herbs, and that was taught over for over a year. But cannabis had its own class, a course all on it. And it's because we had to learn the history and all the science and how it works and the different strains and the different combinations and concentrations and so forth. And so it is medicine, and it should be looked at that. It should not be recreational. I cannot stand walking into a gym and it smells like someone was smoking. cannabis. It's disgusting. I don't like the smell. I think it's irresponsible for you to smoke and then walk into a building thinking people are not going to smell that. I don't think that's a very good idea for you to smoke cannabis and then go work out either. Like I said, I see a lot of foolishness. I see the extremes of people using cannabis that are not Christian. The extremes of cannabis use that they use it for everything. It's their go-to. They idolize it. It's like, there's restaurants, right, that they cook all with cannabis, and there's I've seen classes that they do yoga and they get high and they do yoga, and it's just ridiculous. And I think that's I know people are going to get mad, but it's immature. It's immature, and you're abusing of a plant, and that's really it. To me, if you abuse anything that's good, it's not a good idea. So once again, for people who really need it, this has been a game changer for them. Sometimes I'm having to convince the 70 and 80-year-old person because of the stigma the cannabis has had, in their generation, and still now, the use of it. But once I tell them, just start with this little bit. If you don't like it, stop it, but it's going to help. And once they ease into that and they do it, I mean, it's amazing. Can you imagine? You're taking 20 medications and you get on cannabis, medical cannabis, and then slowly you wean yourself off of all those medications, and you're on no medications, but you're on this. And I'm not recommending that you do that on your own either, by the way. This episode is just for educational purposes. I'm not telling you what to do. Don't go stop your medications and get on cannabis. If you have high cholesterol, you have diabetes, you have high blood pressure, change your diet, change your lifestyle. This is not my go-to, okay? So that's the other thing is there's some conditions I'm not going to turn to this at all. I'm going to tell people, no, do the work. That's really it. Do the work. If there's trauma, if there's anxiety, depression, whatever it is, do the work. But I have known that for seizures, this is a much better option. So let's not knock down the benefits of cannabis. I think that, in the Christian community, there's people who would really benefit from it, even if it's that CBD with a little bit of THC. There's people that are going through cancer treatments, and there's a lot of nausea. They're not hungry. There's a lot of pain. They're not able to sleep. And so there is a time to integrate cannabis in moderation and responsible, right? To integrate that into oncology care, and that can, better improve their outcomes. I don't believe you should suffer and struggle alone if there's such an option. So, but, first and foremost, you pray about it, and you must be at peace of using this herb as part of your repertoire or not. That's the beautiful thing about life. You decide. But if you decide to do it, don't let anyone make you feel bad for using it for medical reasons, and you're being responsible, right? Now, I will say, if you are using or you're going to use or consider using cannabis and you have children, lock this stuff away. You don't want them to have access to it. You don't want your pets to have access to it. I've heard many people say, oh, my dog got into it and he was all high. I'm like, yeah, that's not okay, because they will eat it all. That's the thing. And there's so many different edibles that are enticing, like gummies, right? They look like candy, or chocolate and things like that. You don't want to leave around. You want to be responsible with that. But hey, if you have any questions, I mean, I don't really like to do medical marijuana certifications in my office. I can, but I don't. But, here in Arizona, people can now get a recreational. But do some research and pray about it. And if it's something you think that would benefit you, then go for it. And if not, know that there's a lot of other things that you can do, but in low amounts, it's okay. Nothing bad is going to happen. It's when people are doing the high amounts and they're having these psychoactive effects that I do believe this can possibly give, just an entryway to, spiritual parasites that you don't want to deal with. And I think those people tend to overuse and abuse the herb. So I hope this information has served you well, and you took something new, to know for yourself. If you think that's something that's for you, then go for it. So until next time, everyone, have a blessed day. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.